I'm third generation Indian residential school survivor. We all went to the St. Joseph Indian Residential School outside of Williams Lake. So when I turned 6 in 1973, Granny brought me to town, to Williams Lake, to buy something to go to school in. And I chose a bright orange shirt for my first day of school. Just so excited to be going to school for the first time. So when I get there, our clothing was taken, including my new orange shirt. The National Day for Truth and Reconciliation did not replace Orange Shirt Day. It will always be Orange Shirt Day. So what I always say is Orange Shirt Day, I take a pause and say National Day for Truth and Reconciliation. And one need should never be mentioned without the other. September 30th is not a day of celebration or to say Happy Orange Shirt Day. You would never say celebrate Remembrance Day.
If residential school never happened, there definitely would be a total different way of life and a total different way of communicating. Like the impact of the language is so deep and so entrenched in who we were before.
Being a child in a loving family, you know, living with my grandmother and my grandfather and my extended family, I'd kind of envision myself going out on the land and, you know, being totally immersed in language and culture and really securely knowing who I am and where I come from.
Globally and across Canada, health inequities persist for Indigenous people. We at Interior Health are deeply committed to closing those gaps through continued strategic focus and partnerships to advance Indigenous health and wellness. It is vitally important to provide culturally safe care that respects and honours Indigenous practices and beliefs. In our efforts towards truth and reconciliation, we will continue to listen, support, and work with Indigenous partners and staff to advance Indigenous health and wellness in the interior.
For so many years being put on the back burner all the time, we still have people who are racist. We don't get the kind of care that we should have, that's equal and available to everybody else. We're still the second-class citizens when it comes to the hospitals, when it comes to care.
Every organization, agency that deals with our communities should have language. You know, they should have a good understanding of language, and they definitely should understand history. You know, what happened to us. You know, it's always surprising to hear that nobody knows about residential school, that nobody knows about the 60 scoop, you know. So I feel that that part of history needs to be told.
Real action and change are needed to support healing. So when asking yourselves, what can you do? Pause, and to recognize and remember all those whose lives and whose families were forever changed by the residential school experiences, and treat others with compassion. So what are some tangible actions to address the systemic health issues faced by Indigenous communities? Well, we see that better support for health workers in Indigenous communities is extremely important. We need to ensure that prejudice, racism are also addressed, you know, among the health workers. And most importantly is being inclusive. Many of our people experience anti-Indigenous racism and a lack of cultural safety. And acceptance of our health and healing models needs to be incorporated within the healthcare system.